Welcome back to the Brilliant Fertility Podcast. I am overjoyed today to have Lisa Hendrickson-Jack with me. I'm having like a little bit of a nervous celebrity moment because I've followed Lisa's work for so long, and there feels like there's not as many people as we would hope stepping up to educate in the way that Lisa has. So I'm just so honored today. If you aren't already aware of Lisa's work, I'm just going to give a quick introduction and then we're going to dive in. So Lisa Hendrickson-Jack is a certified fertility awareness educator. She teaches practitioners how to use cycle awareness charting in their practices, and she's authored 3 best-selling books: The Fifth Vital Sign, the Fertility Awareness Mastery Charting Workbook, and the most recent book co-authored with Lily Nichols, Real Food for Fertility. Lisa, you've worked tirelessly to debunk so many myths around cycle health, birth control, ovulation health, and I'm really excited to get to pick your brain today.
Yeah, I'm excited too. Thank you for having me. It's so interesting, to reflect on all the things that have happened in my career. I feel like you had me thinking of it when we were talking before we got started. But as I mentioned to you, obviously this work is so important. And I spend so much time off air working with clients. And so I just hear similar stories over and over and over and over again. Women going to their practitioners and not being listened to, not being supported, not being heard, having to go to multiple practitioners to get anyone to even listen to them, being diagnosed with one thing and being told it was another. I literally just had a practitioner tell me that she spent 10 years being told she had PCOS when she literally didn't, because she actually was on the HA spectrum. Like, it just, this is what I do. So when I'm sharing this information in this way, it's because there's so many women suffering, and at some point you just have to be the change you want to see.
Yeah, absolutely. Even though it may have felt like very much going against the grain, you've described that you started charting your cycles like very early, like well before this was considered something common practice. Like, how old were you when you learned about cycle awareness and started following these practices?
Yeah, it would have had to be around 19. I keep trying to figure this out because I wrote about it in the book, but so I'm a November baby. And so when I went to university, I was 17 when I entered university, and then I, turned 18 around there. So around 19, because it was 18 or 19, because that was around my first year of university. So my backstory on all of this is that I had my very first period. I think I was 13. I've been thinking about this lately, trying to kind of actually like note down the exact dates. But I was 13 when I had my first period. My very first period was painful. My periods from the beginning were painful and they were heavy. And I was very active. I did ballet. I did track and field. I did basketball. I did volleyball. I did all these different sports. And, no one wants to be in like a leotard.
Oh my God,
Right? Like
no.
with all the bleeding. And I did have some of those embarrassing moments, so girls talked. And so I went to the doctor and I said 3 words to him and he put me on the pill. And what I found was that when I was on the pill, my quote periods, like my withdrawal bleeds on the pill, were more manageable for me. So I was on this pill and all of a sudden I didn't have like as bad of cramps, and I didn't have as heavy bleeding. And so being a child, I was like, I'm fixed. This is amazing.
Yeah.
And I wasn't using it for birth control at the time. So I just came off of it periodically. Like, I would just stop taking it because I wanted to see, like, because I was like, okay, I'm fixed. And every time I came off of it, my actual period would come back with vengeance. So in my case, I saw a very clear difference between my actual period and whatever this pill thing was. And I wouldn't have had the language. I wouldn't have called it withdrawal bleed when I was 14 because I
No.
didn't know what that was. But so what happened in my case was, from a young age, I did know that there was a difference, and I did know that there was something wrong. And I didn't know of any friends of mine who had periods that were so painful that they needed to take like they needed to take they took Midol, and then I, moved up to the ibuprofen because the Tylenol, acetaminophen doesn't work. Right. And so I didn't know anybody who had pain as bad as mine. And I wrote about it in my book, but my mom, she didn't have pain with her periods, but she had ridiculously heavy periods. And so she had fibroids identified and they grew to be quite large and she needed to have a hysterectomy. And before she had the hysterectomy, when she had her period, it was like a whole event. Like she had like a tablecloth on the couch that she would lay on. Like she would have to, right? Like it's just so much blood. She was always low in iron. And when she did have the surgery to have the hysterectomy, because of course that's what they did, right? In the 80s. My aunt came to visit and her eldest sister, and she had also had a hysterectomy. So I was young, but I was just privy to these adult conversations. And I just remember thinking like, I don't want to have, like, this is not what I want for my future. So even though I was very young when I decided to come off the pill, so I did the opposite, I think, of a lot of people. I was on the pill when I didn't need birth control. And then when I needed birth control, I came off the pill because I was always a nerd. So I read the whole insert. And, it's funny now looking back at it because I was still a child. Like I didn't understand. Like I used to take, like if I missed a pill, like again, didn't use it for birth. If I missed a pill, I would do what it said. It would be like take 2 or whatever. So, but I wasn't even using it for birth. So when I think about like, why was I even doing that? But like, I didn't fully understand because I was just thinking like, this is for the condition. And so I need to do it properly. Right. But when I actually needed for birth control, because I knew all of that, I knew that I would have been so nervous if I ever missed anything. And I was not that great about taking it at the same time. And I just felt like I was going to be so nervous. So I came off the pill. And I also felt like my periods shouldn't be like this. They shouldn't be so painful. I don't know anything about how to figure this out, but I want to come off of this. So eventually I'll figure it out. So that was like my mindset when I was, 18, 19. And it was right around that time that I discovered fertility awareness. And so, that really sealed the deal. Cause then I was like, oh, wow, my plan was to use condoms, but this is so cool. Cause now I can chart my cycles and understand when I'm fertile or not. And I can also use condoms. So I can use them more specifically. I just felt so much better learning about my body because before that, we were taught that you could just get pregnant every single day of the cycle. And it was just like a constant feeling of terror. So I find it interesting now, 20 plus years later, when I'm speaking to women who are, the age that I was then, they're way more terrified to come off the pill than I was because they've now been told that condoms don't even work. It's a very different world that we're living in now. So I feel like the education now is like, okay, well, one method isn't enough. You need to be on the pill and condoms. So the thought of them coming off the pill now is very scary to a lot of women.
It's a very disempowering place to be. That's for sure. I'm also curious, like when you came off the pill and you decided like, I really want to know what my cycle is doing. I want to understand this. And you knew, it sounds like your intuition was really spot on that like, this isn't normal to have this level of pain. This isn't normal for women to have this level of bleeding and fibroids that just go unchecked. Was there anything else that changed for you around that time that helped you establish a healthier cycle?
So with my journey, I mean, this was taking place around like the year 2000, the year 2001. That was the year that I entered university was the year 2000. And there just was not, there's like, it's interesting to think back. There was no social media. There was nothing like that. Other women who discovered charting, like I remember I interviewed a friend, like one of my mentors who had already been charting. And she was one of the mentors that kind of taught me when I was in my 20s. And she was like, yeah, I went to the library. Right. So
did you get the good old fashioned Tony Weschler?
You got like the old one, right?
The one from 1972.
Like, yeah, exactly. But, I guess the reason I bring that up is because in my journey, I learned about charting and I did learn about the connection to health well before I was able to actually overcome my period pain. It took quite a while. That's one of the reasons why I teach about it now. And I even did have mentors. I was seeing somebody, like I would go to one of my mentors and she would have sessions with me and we'd talk about the cycle. But even with that, she didn't really have a specific protocol that touched my period pain, you know? So it's still, I learned about the cycle. I was able to identify that I had an issue with my thyroid early on, which was really interesting because my temperatures were low and my cycles were not irregular per se, but they were sometimes on the longer end. I look back and I wonder if I had a touch of insulin resistance, you know, and things like that. But really and truly, my journey to overcoming period pain and now being able to consistently have periods that do not, like, that are 0 to 1 out of 10 on the pain scale, that was not instant. That was not my early experience. That came later in my like later 20s when I actually was able to get a hold of that. So although I did learn a lot, obviously I was charting, I was teaching other women to chart, the actual specific painful symptom that I experienced took a while for me to, because there just wasn't the same level of information and availability as there is now.
Yeah, absolutely. I think back to, unfortunately, even for me in naturopathic medical school, we were not taught that level of cycle awareness. Like, you know, we had the general idea of like, this is the follicular phase, this is the luteal phase, this is about when ovulation will happen for most people, although now we know that like there's such variation within that. And I remember the first time a patient in my second year of practice came to me with their cycle chart, like on paper with the temperature graphed out and the cervical fluid mapped. And I was like, what the hell am I looking at? And she expected me to be able to interpret that for her. And I felt so like fish out of water. Like, I was so interested in fertility. I knew I wanted to focus on that, but I felt very unskilled in that area. And it was a wake up call for me that, like, okay, if my patients are coming in more educated on this than I am, like, I've got some work to do. And this would have been around 2013. So yeah, I had to go digging for like, what is my map for this? And started out with, you know, Tony Weschler's work, and then eventually finding like a Cretan method and other methods that gave a little bit more specificity behind the cervical fluid. What I appreciate so much about the fifth vital sign and the work that you do is that it is so specific. There is no, you know, moral bent to it that maybe some other methods have, which I appreciate because it can fit such a wide spectrum of humans and their cycles. But yeah, it's really frustrating that this just isn't a widely available, like, when a woman starts her period, this information should be available. It
I
should
mean,
be
and
common.
yeah, it absolutely should be. And it's interesting because, you know, so literally today, I just started a new class of our mentorship where we mentor women's health professionals, you know, in all of that. And the method that we teach is symptothermal, and we do the cervical mucus. The way that we track cervical mucus is basically the same foundation as Cretan, like his, as he termed it, vaginal discharge reading system, right? But it's very, what's great about it is that we've kind of taken the evidence-based approaches to really help to use the cycle, not simply to identify if you're fertile or not, but when you have that level of specificity, you are able to identify more related to the hormones. What I think that of is interesting, though, is that I don't know if this is part of the reason that we don't have as much access, but if we look at the history, where did this information come from? Who did the research? When we are talking about mucus methods and when we're talking about temperature charting and all of that, who did the research so that we could have that information, right? And a lot of it did come out of the Catholic Church. A lot of,
Yeah.
and I'm not saying that as a bad thing. I'm saying it objectively that that's where it came from. I'm not Catholic, but I just, so in teaching it to practitioners, I think that it is useful to know where it came from. That kind of sheds some light onto why I feel like it's not as widely acceptable or widely accepted. But then it feels like a conundrum to me.
I'm with
But
you.
yeah, but on the other hand, so the reason that I just have been like, who gave me a megaphone, like why this has been my focus for my career, is because at the end of the day, it's not taught. And these institutions, our education systems and even the medical system, like you mentioned in your naturopathic school, like even in all of the different institutions that are teaching women's health, whether we like it or not, it literally just isn't being taught. And I don't even try to focus on why it's not being taught anymore. It just isn't. So what is the solution? Is the solution to lament about the fact that they're not teaching it? Or is the solution for us to make sure that we take it into our own hands and provide that education, whether it's, like you said, for yourself, you found a way to learn about it. And for myself, it's been about disseminating that information so that we can increase the number of women who actually are aware of this. And now, obviously, my focus has been on women's health professionals because the world is a big place and I can't teach every individual human being. And I
Not
really
when you
do
have
think,
millions. Yes.
but I really do, like when people say like everyone needs to know this, I really believe that. And so I feel like the way to do it is to teach people who have the ability to disseminate to thousands in their careers. Like that's what I think is really like, and I've seen an incredible shift in 20 years of being in this field. When I started, like I said, there was no social media and no one was talking about it and no one knew what you were talking. It was a very, very, very niche thing. When I started my podcast in 2014, there were zero, and I'm not exaggerating, there were zero fertility awareness podcasts. There was a handful of fertility podcasts. It wasn't even a thing.
No, it wasn't a thing because
It was
someone
not a thing.
suggested I start a podcast in 2014 and I was like, "What? That's crazy." And so, yeah, I mean, you are one of the pioneers in terms of bringing this into public awareness, into a way that could be disseminated. And for all the ways in which social media can be problematic, it has also opened up the possibility for people to learn about this, for providers to learn about it. Hopefully, the open-minded ones who can understand the value of passing this forward. And, obviously my work primarily focuses on fertility, but I also have just wondered, if we can catch girls who are starting their period at 9, 10, 11, 12, we can start understanding their cycle, teaching them this method, would we also be preventing them from the fertility struggles at 30, 35, 40 years old, the painful periods, the fibroids, like when we can identify what in the cycle needs to be supported, if we can potentially prevent a lot of these issues down the line?
Mm-hmm. I mean, I think that that's possible. I think that it comes with like the cycle education is foundational so that they understand that it's not separate. I feel like that's one of potentially even a bigger myth than the myth that you ovulate every cycle on day 14, which would be that it's just not related. So when you have all this pain with your period, that it's kind of only related to that specific body part, whereas we know that it's related to a variety of things. It could be related to inflammation. It could be related to immune dysregulation, right? Like as in the case of endometriosis, when you have tissue that's growing in places it's not supposed to be growing, that's obviously like a sign of immune dysregulation. So I think there is this potential, but of course the question is who is teaching it and how are we doing that? The conversation around teaching teens to chart their cycles, I always find it to be a really interesting one. I've been asked a lot of times and people be like, so, do you think we should be teaching teenage girls, right? And they get all like weird about it and people have all these different opinions. So what I always say is like, well, you can teach someone to understand their body. It doesn't mean that they have to go use the method for birth control. So there's
Right.
that's kind of the question. Like, do you think girls should use this as birth control? Well, I mean, I think that every woman should have the opportunity to learn how her body works. And I think that for a teenage girl, it can be really foundational to teach her the connection between cervical mucus and ovulation and teach her that she can predict when her period is coming. Because when I was a teenager, like, I don't know what's going on now. Obviously, it's been a while. But when I was a teenager, my mom bought me a subscription, I think, to like Teen People or YM or one of those magazines. And every magazine, they would have a whole section on like period disasters. That was
Oh
the
God.
whole problem, right? Like everyone was just terrified of like having somebody see that you had your period. It was every month and it was consistent. And that was like the only thing that it was. And I would of course go, because I was in that age group, I would go straight to that and be like, oh my gosh, someone saw the blood on her white pants. Imagine though, like, wow, you could just tell her how to, like what her cycles are about. She could learn what her mucus means without even tracking temperature. I'm not even saying that, like, I'm not making a judgment about the type of method. I'm just literally saying, like, without even having her track her temperature, she could pay attention to mucus and she could actually predict her period if she understands her peak day, which would be the last day of her, for like the fertile quality mucus. And then if we just taught young girls about the different phases of the cycle and how that relates to energy and what a normal cycle looks like, so that you can understand that if you have extreme pain, it's common but not normal, and it could be a sign of a deeper, like just the basic
Yes,
stuff that I've been talking about for 20 years. Like this is the kind of stuff that changes a young girl's life, instead of
absolutely.
thinking that
Yep.
like I just like painful periods are just normal and I have to hide it and I just have to put up with it and I just have to deal with it, and no one explaining why your mood kind of shifts around different parts of the cycle, but also not to just teach you to expect that it's normal to be a totally different person, totally sad and depressed and teary or angry and venting at people, to learn that moderate to severe PMS is a sign of hormone imbalance, and there's ways that you can support progesterone and balance that out. Like all of the things. And this is why this is such an interesting topic. Like this is why women get so fired up about it, because we're not taught about it and it's life changing. But when we get down to it, it's not so complicated. It's not so hard to understand. Like we just need someone to tell
Absolutely.
us.
Yeah, and so it's funny because I went to Catholic school. So in high school, the extent of our education around these topics was uh, gradually more horrific STI pictures. So when you're a freshman, it's like pretty like PG-13 pictures. When you're a senior, it's like full X-rated graphic STI pictures just to like scare the bejesus out of you, essentially. And, this idea that absolute abstinence is the only way. And it's just not realistic. And it's not helpful because it doesn't teach people about their body. So I know I mentioned with like learning about the fertility awareness method as a practitioner in my first year, I was angry. But then I started diving more into like the understanding of like why is that the case and what can we do about it. So it is interesting that models like the Cretan method kind of emerged from the Catholic Church, and I think being able to be grateful that like, hey, this is actually a pretty solid method of tracking fertility and preventing pregnancy if you don't want it. But the understanding of your own body is so impactful. And when you have that and when you can be in your truth about feeling like this isn't normal, like it doesn't feel right to have this level of pain, it doesn't feel right to feel psychotic for an entire 2 weeks before your period begins, like this is where change can happen. And it's wild to me that 50% of our population is bleeding every month, maybe depending on what they're going through. I mean, obviously there's such a variation of PCOS and HA and people who are on continuous birth control who have been so disconnected from their cycles that I think just being able to have a shame-free conversation around this
Mm-hmm.
is so important. Yeah, there was just so much in the shadows for me growing up. Even though it was never shamed in my own home, it was not something that you like talked to your friends about. It was not something that you could like ask your health professor about in sophomore year of high school. Like it just wasn't a thing that you opened up about. So the fact that we can have a conversation like this, and maybe, a woman who is dealing with her 11-year-old who's just started her periods can say, hey, there's a different way we can do this. You don't have to go through what I went through. We can pass this on through generations.
Yeah, it's just wild, and um, and there's so many different I think one of the things I was getting at too with just how things started, like not having any access at all and how things are now, it does give me hope. A lot has changed in the past 2 decades. A lot more women know about cycle the charting, and fertility awareness is obviously, it has become more of a common topic, but I will caveat it by saying that I don't think that we're anywhere near to critical mass. Like I really,
Oh, no.
I don't think that. So when you're in the online space of cycle charting and you've, follow the people and you've read the books, you start to think that everybody knows about it. And even though I've been in this field for so long, I am under no, like when I'm in my just normal life and I go to, a little get together with our family, friends and stuff, no one knows about this stuff.
Well,
It is not.
even, yeah, I remember my last well woman visit, I mentioned something about like, they said, oh, what type of contraception are you using? Or what type of birth control are you using? And I was like, oh, I use the fertility awareness method. And they kind of chuckled and say, oh, so we'll see you back for your pregnancy next year. And I just had to deep breath and say, actually, there's a lot of scientific evidence for this being an effective method of contraception when used appropriately. So here are some resources. But yeah, just knowing someone who is in that space, who had been in that space for a couple decades at that point, based on my knowledge of her training, it's like, all right, we've got work to do.
Yeah. Well, I did a podcast episode. I don't like, I do them ahead of time so that I never remember when they're released. But I covered this study, and it was this study of largely women's, like female care providers. So there was a high percentage of nurses and midwives and, doctors and naturopaths, but it was 97% of the respondents of this survey were female. And it was about their knowledge and attitudes towards fertility awareness based methods. And honestly, if you read it, it's shocking, because you would think just because someone is female, we tend to, that they're going to have more knowledge on these topics or whatever. But whether or not the person that you're working with is female has nothing to do with their education. The education is the same, and the education is lacking in this area. So the study was really, it was a very small percentage of the providers that thought that fertility awareness methods were viable at all. And there was a heavy bias against them. And there was a mix of qualitative and quantitative data. So I always like the qualitative studies, because then they put in what they actually said. But if you read what they actually said, it was like, well, my Aunt Harriet, she used fertility awareness. She had like 8 kids, so it doesn't work for her. And like the actual things that they said about it were very, very negative. And there was only a small percentage who had any real training, or anyone in their clinics were trained in the methods. And so there was knowledge of specific methods by a certain small percentage of providers. But I feel like this is something that we all need to be aware of. We need to understand where we're actually at. So even though there's more people talking about it on social media, your average health professional, and it's regardless of what kind, it's just not something that's taught. I was
Yeah.
interviewed maybe a month or two ago, and it was such an interesting interview. I think it was like a medical doctor, and then they did the podcast together. It was a medical doctor, I don't remember his name, and then his partner of like the podcast partner, they do it together. She was not a medical doctor, and it was like she was the one that was like, I want her on the podcast. And he and this came out, like they were talking, that's why I know this, and he was the one that was kind of like, fine, whatever. And then he picked up my book and read it. And the whole interview was like him asking me all these questions. I went to med school and I'm looking at your chapter 3 and you're talking about, the cervical crypts and S mucus and L mucus. And they didn't talk about any of that. It was like a whole situation. And I'm like, I know.
I know. So now that we've established that, unfortunately, the vast majority of healthcare providers aren't yet trained in this, the public can start learning about it. The public can start educating their providers in little snippets about it, introducing them to your work and such. But if you had to narrow down the benefits of fertility awareness method, of symptothermal methods, what would be the top 3 benefits of using these tools?
Oh, that's such a great question. I honestly don't know if I've ever been asked that. The top 3 benefits. I think that one of the benefits, clearly, like we've been talking about, is that you do learn about your body specifically. So I think that a lot of women are disconnected from their bodies in the sense that they're having these symptoms potentially, and they may be even going to their providers. And it's a common experience for women to go to providers with symptoms and have them be dismissed. So, and then the kind of like gaslighting stuff is real. So, a lot of women have these symptoms, but it's like they've been taught that it's normal for things to be abnormal. So, whether we're talking period pain or spotting or whatever, or even PMS or whatever, like they've been taught that it's normal. And so I think what I've seen is that a lot of women are struggling with stuff, but it's like they don't even, and I don't think it's specific, like I don't even think it's specific to period stuff. Like if you think about people who work in like with clients that have GI issues, it's not uncommon in those, like if that's the population, like how many times do you go to the bathroom? Like, right. So I do think that like, oh, I didn't know that going once a week was a problem, right? So like, I'm not saying it's specific to menstrual issues, but that would be one thing where when women start charting their cycles and they start to understand the connection, like they even just that general information about what's normal and what's not normal, then all of a sudden they realize that they don't have to keep putting up with whatever it was. So I would say that is a huge one, and it's very empowering because that's like a first step for many women to actually start to address some of the issues that they have or even know that it was a problem. And I'll give one other example, which is, I have to put specific questions on an intake form. If I don't put a specific question about period pain and have them rate it, I could have a client with 9 out of 10 pain and they don't bring it up because they've had
So
it for
true.
so long, and they just, this is just, they're not even there for that. They're just like, this is other thing. But yet there's this big elephant in the room, right? So that would be the first benefit. The second benefit, I think, could be just having the freedom to not, like, you have the freedom, if you're looking to avoid pregnancy, you have the freedom to not be on contraceptives. I feel like I've spoken to so many women over the years who they just don't know about charting. They've never learned about it. And certainly no one's ever told them that it could be an effective method. No one's ever talked to them about the actual research behind double check symptothermal methods in particular that have the highest efficacy rates and even high typical use efficacy rates, because there's a wide variety of different effectiveness rates depending on the type of method. So I think when women don't even know about charting and they don't even know about this option, they often feel kind of trapped. They don't feel like they have any options. And then whatever side effects that come from this, if they happen to suffer side effects, again, that's another thing where some of them don't even know that what they're experiencing is a side effect of that, where they might have started developing anxiety or panic attacks, but they've been on the pill for 10 years, so they don't even know that that could be related. So having just the freedom to make an actual choice of like,
Yes,
right? Like,
absolutely. Part of informed consent. Like
yeah,
if you're not actually given all of your options, that's not true informed consent.
yeah. You can't even, I would say you can't even make a true choice of what type of birth control you want if you don't really know that all of these other options exist. And I suppose another benefit, so I'm just picking three, like I could probably go on for an hour, right? But another benefit I would say is that for women who chart their cycles, and it kind of tags along to the birth control angle, when I was in those early days in university, I, was taking all these women's studies classes and learn about feminism and all this stuff. But the focus is often on, like, even when they talk about like reproductive rights, like the focus is often on avoiding pregnancy heavily. I believe that a true, like, free woman, those true reproductive rights are having, again, the choice to both have children when you want and to avoid pregnancy when you're not ready. And I believe that, when you chart your cycles, I've seen it, you're not altering your body. And if you're learning about your body at the same time and you're learning about what's normal and you have the opportunity to work on whatever's going on, you learn a little bit about, oh, when I stay up all night and drink 10 cups of coffee and work out and skip breakfast, my cycle gets all weird and I have super raging PMS. But when I don't do that, my spotting goes like, right. So you have the opportunity to learn how your cycle works, how to support your hormones. And when you're ready to get pregnant, it's potentially more likely to happen sooner and easier because you actually understand what's going on. And if you charted as birth control, for example, then when you're ready to conceive, there's no transition. You
I
just
would
switch the
agree.
days.
I would agree. And this is purely anecdotal, but I've been in practice for 12 years. And the people who have come to me already charting their cycles, or they came to me 3 years before they wanted to get pregnant and said, I really want to learn about my cycle. How do I improve my hormone health? How do I learn about my cycle? How do I avoid pregnancy now? And we started charting then. They tend to be the ones who get pregnant faster when they're ready versus the people who are coming having had no knowledge of their cycles and, just at 35 years old learning what a follicular phase, what a luteal phase is. Not only is there so much pressure then to figure it out and learn it and sometimes like obsess over the data, there's which we can talk about in a moment too, because there's just so much more opportunity when you've had that time to really learn, like, why is body trying to communicate and what are the lifestyle factors that can impact it. I've absolutely seen it in my own cycle as well. But I do want to circle back to, because both of us started to laugh when we talked about obsessing over this. So when we do often have people start learning about charting their cycles and they're like starting to obsess about, well, what does this temperature mean? It was a little bit lower on this day and it was higher on this day. And I did wake up to pee. So is that really accurate? And I don't know if this cervical fluid is normal. Is this fertile enough? Like, can you speak a little bit to that obsession that may come when some of us chart our cycles?
Yeah, it's really funny to kind of call it out. This is a topic that comes up a lot, and the way that I talk about it, one thing also to give a little context, like keep in mind that I have been in this world for over 20 years, right? And I've charted all this time, and I've charted through I didn't actually chart while I was pregnant, but I've had 3 children in there and charted, postpartum, and now I'm 42. So we're getting into that premenopause shift. So a lot of personal charting experience, but I've also worked with, thousands of clients at this point. And so, so one thing I'll say is that charting, I think by definition, think about the woman who desires to, track her cervical fluid and her temperature and who's willing to get up and put the thermometer in her mouth.
We might be a little type A. Is that where you're going with this?
This is where I'm going. Okay. We're type A, and I'm calling it out because I'm also yes, this is us. We are the type A people. Okay. Welcome. So by definition, the women who are willing and excited about tracking, we're already overachievers. Okay. We're like a little neurotic already. And then we're kind of perfectionists. So we looked at the book and it's like, right. So yes. So this can be a problem. This is one of the reasons I think why working with someone can be helpful. Hopefully someone that has experience. So, I joke that 90% of the job is talking your clients off the ledge. I stand by that claim.
I do too.
Stand by that claim. And really and truly though, my philosophy around charting that I've always taught my clients is that, the goal from my perspective is not to have a quote perfect chart, because you are an actual human. You are alive. And the whole point of my work, right? I named my first book, The Fifth Vital Sign, because I'm arguing that your menstrual cycle is a vital sign, right? If you were to take your temperature all day, every day, you're not going to be the same temperature for 24 hours straight because you're human. And if you chart your cycle, you're never going to have exactly the same cycle over and over again. And You're going to go out, you're going to go on vacation, you're going to have a month where something stressful happens and all of that. So the goal from my perspective is obviously to understand your body, to understand normal parameters. A parameter isn't 28 days exactly. A parameter is a normal range of of the different aspects that we can track, whether it's mucus or temperature or overall cycle length or luteal phase length. We want to understand what's normal. And I feel like you don't want to look at your cycle as this being like right or wrong. You want to be starting to work with it. Like it's like a dance. Okay. You're learning to dance with your body. You're learning that, and you're learning your limits. So, you try something, you see some success, and then you fall off the wagon and your cycle goes back. Like it's information. So this is how I talk about it with our practitioners and with clients, where we can get into the weeds for sure. So if you have that one cycle where the temperature was really weird, like I'm all down for that. We can have that conversation. I call myself the 50 questions lady. I'm always in there like, okay, well, was anything different this month? I encourage clients to track certain details. Like you can track the time that you woke up. You can start to know what specific factors impact temperature changes, and you can write that on your chart. And we can go through that all together. But at the end of the day, the purpose of charting, again, from my perspective, isn't for us to go crazy about every single temperature. The value in charting from my perspective is actually seeing the shifts and changes and patterns over time. So one of the things that I try to convey, especially to new charters, love you guys, is that like I'm like 20 something years in, okay, like deep. So one cycle to me means a lot like less than your very first, like that's all that you have. That's like all of your data. And if you've been charting for 3 months, you have like 3 cycles. So each cycle is like, why is this like, but for me, I would actually look at those 3 cycles and I would look at, well, what happened in the first cycle? Were we charting correctly? What happened in the second? Like I'm actually looking at it differently. I'm looking at the shifts that have happened, the changes. And I also know that you have, if you continue charting, potentially years, if not decades of charts in front of you. So the significance of that one specific temperature on that one chart to me is a very different thing. So I try to find the most loving way to be like, I know it matters. It does matter, but probably not as much as you think it does. We need to put it into context. And the bigger picture is actually the other conversation that's happening around, like, why are we seeing these patterns?
Thank you. Yes. Sometimes I feel like mother bird, and if people are hearing it only from me, it gets they start to get a little deaf to it.
Yeah.
So just that, but I would absolutely agree. It's like we need bird's eye perspective. What are the patterns? What are the lifestyle influences? What is this particular part of the phase telling us about what your body needs? What is it communicating? What I often will say is the data point is neutral.
Yes.
And if we can like disconnect how people tie in like their worthiness as a human or their ability to do something right, because there is often that right or wrong, like, am I doing this right? Is my cycle right? If we can disconnect that and have them really start to learn that like the data itself is neutral. We're not striving for perfection. We're hoping for understanding more than anything else. And then as we start to implement the lifestyle factors, the herbs, the acupuncture, whatever modalities we're using, how do we start to see a shift? Does that lengthen your luteal phase? Do we see more days of fertile quality cervical fluid around ovulation? Do we see better sleep? Like there's a lot of other things that matter more than this one little data point that was weird that day.
Yeah. Well, and it's a practice. I feel like it's more than just that data point. It's a whole practice because, my experience and also the experience of my clients is like, they kind of have to go through those different stages of learning, so that is totally normal, right? To be in that stage where you're obsessing over every little thing. I feel like that's part of the learning journey until you really start to kind of like come into the fullness of what this really is, which is you have this way to track what's going on in your body. And I said before that it kind of alerts you to your limits. So one of the things I love about charting is that it is a personalized situation. And so I'm sure you've had conversations with clients that are feeling discouraged or frustrated because they'll say things like, well, my friend gets to eat whatever she wants and her cycles are fine. And, here I am and I have to give up, blah, blah, blah. First of all, I always say, well, we don't know what your friend's cycles really look like. So there's that. But at the end of the day, the charting helps it to be a lot more personalized. And while it can be very humbling, I've had a number of our practitioners say that. They were like, this was really humbling. I came into this and I thought that my cycles were totally fine. And then we started charting and I was shocked. Not that there was like a big problem, but you start to notice different nuances and differences. It's like, I didn't realize I still had something to do. Or clients who have always had X. My luteal phase has always been 9 days. So I just thought it was totally fine. Right?
Kind of like back to having a bowel movement once a week. It's like, we don't know what we don't know.
And they didn't come for that because they didn't think it was a problem. They were like, no, I'm good. My cycles are always, but then they discover that, wow, like this, it was a running theme in one of our programs. It was really funny because it was like, and then it was like, I was like, do I need to go out and buy a pregnancy test? Because it's like day 13 of my luteal. I've never had a 14-day luteal. And then it finally came and I was like, oh my gosh, right? But these are the things, like we're learning about like what's normal in general. Like one of the things I'll often say is human beings, we always want to be so unique. We think we're so individual. If I go to the zoo, they know like what's going on with the monkeys, right? It's not like this particular monkey just gets to have like a 9-day luteal phase, right? Like we know what monkeys, I don't know anything about monkey luteal phases. That was just an example. I'm just saying, like if someone was to talk to you about like an elephant gestational period, they're not going to just be like, oh yeah. And that like this particular Gina, the elephant, has a totally different gestational period than the rest of the elephants, right? But for some reason with us as human beings, we often think, right? Like I'm different, I'm unique. This thing happens in my menstrual cycle. And this is because I'm Tina and this is my method. And it's like, no, Tina, we're all human beings. There's a range of what's normal. And so when you start to look at the cycle in that way, it helps you to kind of know where you are actually at. And then if you didn't know that and you start making shifts, you can actually see like that potential. So I feel like I kind of forgot where I was going with that, but definitely that has been a theme.
Yeah, we had started by just, talking about like the limits, like it helps you understand your limits, but like where you are also. I'm also curious because you kind of alluded to this with your own cycle journey heading into 42 years old, heading into perimenopause. What insights is charting giving you now at this phase of life?
Well, so there's a few. For me personally, I think beyond it's like a two-parter because having the knowledge that I do about what is normal and what's not, and what the premenopause phase is characterized by, it means that I am not nervous when I see some of those changes. So if we go back to that type A situation, you could have had there are plenty of women who have pretty consistent cycles. It doesn't mean they're exactly the same, but they have a pretty kind of consistent range of what they experience. But then when you get into this age category, you start to see potentially different things. Like one of the things that many women see as they get into this premenopause stage is the occasional really early ovulation, or they see shifts in how their body makes hormones, having a more difficult time making progesterone. For someone like myself, I've been charting all these years, so I've had a lot of time to really learn my body and understand what my limits are. And, when I was alluding to that before, it's like, I think it's natural for people to kind of they test every now and then, I had a client once who was fully hypothyroid and she was on medication and she just decided to go off of it. I was like, okay. Oh. And then her cycle was like all of a sudden like 40 days, like whatever, like it was very different than what it was before. And I remember she was like, could this be related? And I was like, yes.
Heck yeah.
And it was like, oh, the thyroid medication was actually working. I have been taking it for, I do think it's natural though. I'm not really trying to poke fun. I think it's natural, especially if you've had certain thing for a long time or whatever, like you start to wonder, like, is it even working? I've been taking this stuff for so long. And then you come off of it and you're like, oh, wow, it actually.
Yes, I think it is natural and important to question things.
Yeah. So I feel like, yeah, with the cycle, you know, with me, I've had a lot of time to lean into that. So I feel like for me, it's a gentle, like I'm observing it in real time. And over the last several years, I've started to see a gentle movement in my cycle length to having a bit of like shorter cycles. And let's say my average cycle length would have been closer to like 32 days, 31 days in my, like in 10 years ago. And now my average cycle length is closer to like 28 days, you know, and having more of those 27-day cycles. So seeing that kind of lean towards potentially an earlier ovulation, my luteal phase length has been pretty great, which has been nice. But you know what I'm saying? Like I'm experiencing this as a gradual thing. I'm seeing this gradual shift over many years to having these kind of cycles that are a little bit shorter. I'm noticing that I have to pay a lot more close attention to my what we call foundational factors in my program. So when I was in my 20s, I could have gotten away with staying up late and, you know, drinking and all this stuff. And now I definitely notice that I'm more sensitive to that. And, you know, my cycle is in line. So if I want to continue having these lovely luteal phases and, you know, minimal PMS, minimal to no PMS, like, right, like just having the dignified mood change as opposed to the like kind of situation, then I have to be kind to myself. I have to have boundaries. I have to say no to certain things. I have to prioritize my sleep. I have to make sure I'm prioritizing my meals throughout the day. I have to, you know, make sure that if I'm working out a little bit more, I'm not like a huge workout person, but I've incorporated some weight bearing activities and, you know, things like that. So if I'm like, I've just noticed those kinds of things. So I feel like my experience of it is not simply just the charting, but it's also the knowledge around what is normal in these phases. I have seen clients have the absolute opposite experience to that. You know, women who may have been on the pill for 10, 15, 20, 30 years, and all of a sudden they're coming off of it. They have a baby and all of a sudden they're like, what, 38, 41. They've never had the opportunity to chart. They've never had the opportunity to learn to work with their body, to understand that their body has limitations. And this is something like if you've always been on the pill and you've never really had that feedback and you work out a lot or you drink coffee a lot or you skip meals or you do whatever you do, but you never had the cycle to kind of like alert you to the fact that maybe your body isn't happy about it, like, you know, then all of a sudden when you're 40, it's like very difficult because your body is no longer being like your 20-year-old body's like, okay, could you just please, could you stop?
We didn't hear the whispers, right?
Yeah.
So
But
now it's yelling at
like
us.
a 20-year-old energy, it's more polite. It's like, could you please, but your 40-year-old body's like, look, lady, if you're not like, right? So, I mean, yeah,
I find so much truth in that. And what's interesting, I think, you know, as often people come to me as like their last resort for fertility, is I'm working with an average age of about 38 years old. So they haven't had that opportunity. They're just now learning to listen to that body wisdom, learn their limits, learn their boundaries. And yeah, so if anyone out there is in their 20s listening to this, like, okay, you're ahead of the game, start charting. And know that if you are 38 or 39 or 42, it's like, it's never too late to start learning about your body either. So don't feel like you've missed out, you know, feel whatever you need to feel about it. And then like, let's get to work. So I appreciate you reminding me, like, we can't lament about it. Like, we just got to get to work. We just, you know, we got to start learning now.
And I remember when I started the podcast, I would get a lot of emails like that. Like, I can't believe I'm 40 years old and this is the first time I'm hearing about it. And so, you know, take the time you need to be upset, I guess. Don't dwell on it forever, but like acknowledge the fact that it's unfair and unfortunate that you weren't able to be taught. But I do think what you said, you just like, now you know it. So we just have to go from here because there's not really a point of of lamenting in it. I've had many women who have discovered it later do all kinds of things with that information, whether it's that they just start charting themselves, they learn as much as they can, or whether they start sharing with their daughters or their nieces or their friends or whoever. And so there are definitely ways to make this better. And I've just seen time and time again, like whatever experiences that you have, I think they happen for a reason. And a lot of those times we're able to, like, if you did have that experience of learning it late and you are kind of devastated, like you're just like, I would have loved charting. Like, what is going right? If that's you, then take that and use that, because that energy is going to help you to bring that to so many more people, because you don't want the experience. You don't want them to have the experience that you had.
Yeah. Oh, I think I need to devote a whole episode just around transmuting that energy.
Yes.
But for now, Lisa, I know I could pick your brain for hours. This is why you have to run an entire course about it, because you cannot just condense all of this information into an hour. But how do people learn more about this work? How do they learn more about you or working with you?
Well, first of all, thank you so much. This has been great. And you're right, we could talk. We're very like-minded, so we could talk for forever and ever. So to learn more about me, my current passion, as I mentioned, is teaching women's health professionals. So I have a whole mentorship certification program where this is what we do. So we're teaching women's health professionals to bring this knowledge to their clients in a scientific way, and how to use the menstrual cycle essentially as a vital sign and diagnostic tool in practice. So it's so much fun. I do have an ebook that I like to share for anyone who wants to learn more. It's called How to Interpret Virtually Any Chart That Your Client Throws at You. So that's really fun. fertilityfriday.com/chart. You can find out more about me at fertilityfriday.com. You can, if this conversation interested you, I mean, I did mention that I started podcasting in 2014. We are almost at 600 episodes. It is wild.
That's incredible. Yeah. The Fertility Friday podcast, I mean, literally it was one of the first podcasts in this realm that I listened to. And so it's wild, but 600 and how many? 42? That's incredible.
Almost 600. We haven't quite cracked that yet, but and what I've been talking about recently, I've been going into the research. I shared a little bit about that paper I talked about, nerding out day and night, but really and truly that's been my focus. So we do a lot of those episodes where I kind of break down some of these interesting research papers and talk about different issues related to fertility awareness. So just type Fertility Friday in your podcast player. It's kind of funny because after all these years of podcasting, someone else called their podcast Fertility Friday. So just look for the pink one. And you will find me if you're on the socials at Fertility Friday on Instagram. And I mentioned my books. Real Food for Fertility is my most recent book, co-authored with Lily Nichols. And the reason that we wrote that book is because, I mean, there's a couple of reasons, but she wrote Real Food for Pregnancy. And for the longest time, when I would have clients asking me about the nutritional foundation to fertility, I would say, okay, go get Real Food for Pregnancy. I know you're not trying to get pregnant, but could you just just follow the nutritional strategy? And when her, pregnancy clients would be asking about fertility, she would be recommending the fifth vital sign and, okay, we'll learn about charting and right. So this was us coming together to create the ultimate resource for women who are trying to conceive. And the other piece of it I'll say is, even if you're not trying to conceive, this lays the nutritional foundation for healthy hormones, healthy cycles. So when we were writing it, in my mind, it was the textbook for my program. There's enough data for it to be a textbook, but it's written in a way that doesn't feel like that at all. I think Lily and I, for some reason, we've been blessed with the skill of disseminating very complicated research topics into like a readable format. So I feel like it's very welcoming, but it's jam-packed with actual evidence and data. So for anyone who appreciates that and is looking not just for information, but also to feel confident about where it came from, I think you'll appreciate it.
I appreciate it so much. And it's one of the recommended reading materials for our Brilliant Fertility program as well.
Well, thank you so
Lisa,
much. And I'll just say one more thing. I'll just say, like, the first chapter you can get for free, realfoodforfertility.com, in case anyone wants that information.
That is awesome. And we'll drop all of these in the show notes too, so that you guys can access the ebook and the website and the Fertility Friday podcast. Make sure you're on the right podcast for that. And Lisa, just thank you so much for the work you do. Thank you for taking the time to be here, because I know that your schedule is full, and I appreciate you getting here and spreading your message.
Well, thank you again for having me. This was so much fun. It was honestly such a great conversation, and I feel like we are like, what are we, sisters from another, sisters from another mister? Is that what it is?
I'll take that. Yep. It was so much fun. I love when we can like genuinely get some laughs in there. Like, yeah.
For sure.
Oh, thank you. Thank you. All right, you guys, as always, thank you for listening. Thank you for being here on the Brilliant Fertility Podcast. Leave a rating for the podcast on your favorite listening platform, and be sure to share this far and wide.